So welcome to another episode of Vital DocTalk. And on today's episode, we have Dr. Nell on the show. Dr. Nell Smircina. Did I say your last name right, Dr. Nell? I didn't get to practice.
Yeah, it's Smircina, but there's a reason everybody knows me by Dr. Nell. It's way easier.
So I nailed the first part right. But anyways, this is my second time talking to Dr. Nell. Guys actually and gals listening to the show, I like to do an intro call. One thing that I love about Dr. Nell is she actually also has a podcast, so I'm going to definitely be touching upon that. But before we dive into what I want to know, Dr. Nell, why don't we get a background on you, how you started, and the future of where you think you're going to go?
Okay, absolutely. Well, first, thank you so much for having me. Great to be here. I enjoyed our intro call too. So just a little background on me. I have a integrative medical practice here in Beverly Hills, California. We do primarily acupuncture, functional medicine, some concierge care in home, some in office. And by the end of the year, we're actually going completely concierge. So there'll be that designated point of entry for any patients coming in. Our specialties include men's health, primarily andropause, so middle-aged men who really want to just feel like they used to 15, 20 years ago. So part of the whole anti-aging movement and optimizing health. And as an acupuncturist, my specialty is post-surgical recovery. So work with a lot of surgeons here in the area and kind of all over for patients to optimize their healing process. That can start literally the day after surgery, and a lot of people don't know that. So for people who are thinking they have to wait weeks to get into PT, acupuncture is an incredible option to help speed up that process. And I got into it because I was in other aspects of medicine and wanted to expand my scope and be able to talk about patients about things that are really relevant, like their sleep, their stress, their lifestyles, all of these things that really impact our health and our ability to heal.
I love that. And tell me more about, because you were in the field and you're like, I want to take it to the next level and I want to learn more about acupuncture, which is, I think you told me, is also classified as insurance providers actually help in California versus like in Washington or other states. I don't think they're as friendly to acupuncturists. So yeah. I thought that was pretty interesting. I think I restated that factoid to my girlfriend who actually works at a hospital. What about the future? What are your plans there?
So as much as I do love clinical practice, I coach a lot of students and practitioners, and I'm very fortunate to be involved in the growth of a medicine on a larger scale. So I sit as the president of CSOMA, which is California State Association for Acupuncture, to help with any type of advocacy, legislative work, and involved with the American Society of Acupuncturists, which is obviously a national association. But I think for the future, that's more where my happy place is. I love the idea of acupuncture actually being in the standard of care. And having worked in other aspects of medicine, I was originally going and doing pre-med, thinking I was going to be a surgeon and wanting a little more balance there. So settled into physical therapy and then realized, no, I need an even bigger scope than that. Able to help patients. And I really see that as the future of healthcare, more of an integrative approach. And yeah, that's my happy space. I want to be able to help that medicine actually grow and integrate into the standard of care.
Very cool. And I know you do teaching. Do you see yourself doing like more teaching in the future or expanding your practice? Or I don't know.
Both. Yeah, both. Right now, we're trying to hire some additional practitioners so that I can serve more as the CEO, which I really love, and the medical director, rather than being the hands-on practitioner all of the time. I'll be able to keep my core group of patients that I really want to work with, but be able to help new practitioners coming in the field to grow as well. I do enjoy teaching. I've taught orthopedics and practice management and growth strategies in the various master's programs for acupuncture. So I do want to continue with that. But I love the idea of kind of having like a mix of everything. I'm someone who's very uncomfortable when things are not busy. So for me to be in one space for 12 hours in a day, not great for me. So love the idea of, okay, I'm practicing on one day, I'm teaching on another day, I'm flying for a VIP patient here a different day, and kind of keep it interesting.
Super cool. So let's go into your practice, right? And my favorite section of the show, which is how you grew. So tell us, your story. I'm sure everybody starts from zero. And I like to listen to the Zero to Hero transformation. So, how did you first start and how did you first market your practice? And then what have you learned today that you're really focusing on?
Okay. So I actually have been, from the very beginning, very focused on a referral-based type practice. I don't necessarily think that's, the way to go for everybody. I think there are really strong marketing approaches, but being more of a boutique practice, serving more of a high-end clientele, like a cash practice in Beverly Hills. Beverly Hills is such a community. So you have to know people, you have to be able to communicate with people. And when you do have a niche practice, even something like men's health, for middle-aged men, people run in their same circles, right? So if there's any type of barrier of entry to my practice, whether it's cost or, a service that I don't really provide, the people who have already come to me can speak to what the experience is. So referrals are very powerful for that reason. They're not referring someone in who wouldn't necessarily be a good fit. And also working with different providers who I might fill a gap for them with something that they need. So for example, working with surgeons, they want their patients to have better recovery. They don't really deal with the recovery aspect of it, and that's something that I can handle. And how I got started, I was just absolutely all in with my school and working in the industry as much as possible. So I go to a ton of trade shows. I've done consulting work for herbal and supplement companies, and I've worked in the education arena. Even when I was in school, I was working in the school clinic. And then as I was completing my doctorate, I was running the school clinic. So I tried to figure out as many multifaceted opportunities as possible to really gain an understanding of things outside of the clinical component, because as everyone who's gone through a medical program can speak to, you're very prepared clinically. You understand the medicine, you understand biology, you understand physiology. However, you're not necessarily feeling 100% prepared to be an entrepreneur, to be a business person.
Yeah.
For things you have to figure out.
That's why we have this podcast, for sure. 100% agree. So tell me more about, your relationship building methodology, right? Because we talked about how podcasts can help with that. And I think that's what I'm going to end up titling this episode. But, first, you started out, was it just like through cold email, letters, just probably obviously your network? Mm-hmm. And then how did it develop now? Because then you talked about how your podcast grew, and helped develop those relationships, right? So I'd love to learn about both.
So initially, I was just kind of piggybacking anything I was doing. So I'm like an avid fitness person. So whenever I would go to a studio, whenever I would go to a gym, I would just make that part of my process. So if I ever saw someone who was complaining about an injury, complaining about pain, I would make sure I talked to them. I would make sure they got my card. I would also, and this is something I think that no matter what your practice looks like, you can benefit from this, thinking about, okay, my ideal patient, who do they already put their trust in, and who do they already spend their money with, and connecting with those people, because those are the people that patient already trusts. So there's going to be that trust when there's a referral made. So even in a gym setting, I became friends and friendly with all of the personal trainers. So if I'm at Equinox and you have a personal trainer who has a client who's paying $170 a session, they're already pre-screened financially to come in. They already are invested in health. They're there at a gym. So finding these opportunities of who can I connect with, who is already servicing my ideal patient, and they can help with that pre-screening process for you. So then it's not always you having to connect with someone one-on-one to bring them in.
Yep.
To back to the podcast question that you asked, because that was something that I did pretty recently. And I've loved how that connection has been, because, a lot of practitioners, like, we can speak to this. You want to connect with somebody. We're all very busy. Maybe you pop by their office in the building and you meet them for a hot second. And then suddenly you're like, wow, that was like 3 months ago. And I never followed up with that person because I don't know what you even say to them. And the podcast was helpful because I had a lot of these like 1 or 2 touch people that maybe I had met through Chamber of Commerce, or I, had a shared patient with, but it was only one patient. So we had a very brief conversation, or they're in my building and I've seen them in the elevator. But the podcast was an additional, very powerful touch point to that doctor and their staff. So to be able to invite them on a podcast, nobody's really going to turn that down. They're more interested in that than they would be in a cup of coffee. And it's like having a cup of coffee with someone, but you're both able to showcase what you do and get to know each other a little better. And then the follow-up touch points from that are the release of the podcast. So, following up, obviously thanking the person, following up, telling them when it's going to air, connecting your team with their team so they can coordinate the release of the episode or the content that was done, and kind of streamline that with the different social media platforms. So there's a lot of opportunity for additional touch points and getting to know each other. And then even when you're like, I'm at a loss for words, okay, we've released anything, I don't know what to talk about anymore. When you get feedback from people on these episodes, which you will, reach out and share that with the person who was a guest on your show, because they love to hear that you got positive feedback about their episode. And it's just a point that could lead to another cup of coffee.
I love that. I love that. Do you have a story of somebody where I'm being greedy here, guys, by the way, I'm looking at my own podcast. I'm like, cause this is literally what I do. Do you have in fact, I just got off the phone earlier today with a doctor. Like, we're always looking at contact associations, et cetera. And he, after the episode, I said, okay, well, let's touch base. This is what you're looking to do. This is what I'm looking to do, et cetera. And he introduced me to some awesome doctors. And that's all you need to do for building up your company, your business, or, relationships. That's all it is. So do you have a story where you do an episode with somebody, right? And then how do you get in contact with them again? Do you just say, oh, well, thanks for the episode. Let's, and now they published it. This is after, by the way, after they published the episode. Do you say, hey, Bob said it was a wonderful episode. We should meet up again. How have you maintained those relationships after is what I'm curious about. Because I feel like the podcast, especially the first episode, it's much more formal. But then once you get a couple of reps in with the person, then you're like, okay, I've got a relationship.
Yeah. So there's a couple ways you can do it. A really great, success story that I had with the podcast specifically was just my team really ended up vibing with this doctor's team that I didn't even really see. I mean, I was like, oh, I could refer to this person, but there was a little bit of overlap in our practices. But my team that was working on social media and the digital marketing, and then his team as well, really connected. And that team had an additional doctor that was looking for someone with acupuncture. And they didn't even realize that, acupuncture and post-surgical, I had no idea that was a thing. But through the continued contact with the team, because that's another thing, it's not always going to be doctor to doctor. You can use the points doctor to doctor, but utilize your team too. I was asked to speak at a summit that's in October, and the woman who asked me to do it had listened to my podcast, and she was also like, oh, I loved this other person, on your podcast that you had. Would you mind if I reached out to them too, to be a part of the summit? So it works in a lot of different ways. It's not just for the host of the podcast, the guest of the podcast too. So that's what I love about it, because someone could be tuning in for one of those two people or for the content, and then there could be multiple opportunities that branch out of that conversation.
Fantastic. That's a great story. And I was thinking to myself, man, I've got to get my team more involved. My team publishes it, but we don't co-promote, we don't work together with the other team. That's really smart. And I'm going to steal that for sure. So moving on to the next part of our good old format. So tell us about COVID and setbacks, right? How have you been impacted? How have you seen others respond? And how are you responding to come back stronger?
Okay. So when COVID happened, thankfully, acupuncture is primary care in California, and we're considered essential. So I was not required to close, but that being said, a lot of people did. And a lot of that is because, the scope of practice for acupuncture and functional medicine is broad. But a lot of people only use the needle. And so we don't think outside of the fact that, oh, wait, we're also able to help with nutrition. We're able to prescribe exercise. We, are able to do supplementation. We can read blood work. We can order blood work. And thankfully, this was a time when people needed to be really focused on their health. So that was the opportunity I grabbed, and just really staying in contact with patients, because I went down to probably a quarter of my volume when COVID first happened. So even though I was still open, it was very low volume. And even though I was under the impression it was going to be kind of a quick thing, I think that was our American arrogance, by the way. We were just like, oh, this is going to be no problem. We're going to get through this in 2 weeks. That did not happen. And as it, became longer and longer, people started realizing, oh, I'm not just going to take a long vacation for 2 weeks in my house. I still have to figure out how to live and take care of myself at this time. So I had started with very personalized emails towards patients and a follow-up call. And I wasn't really harassing people with calls. Like I maybe did one for my current patients, but it was more via email. And the first email was like, how are you? Is there anything you need? Totally get it. You're not comfortable coming in, but tell me how you're doing and tell me what's working and what's not. And then follow-up emails that were all value driven. So some recipes for boosting your immune system, supplementation, herbs, tips on, moving throughout the day and helping with anxiety, because I saw first everyone's concerned about immune system. Then people start getting to this place where they're very stressed and anxious, and even people that are not normally stressed and anxious. So, it was like, first I'm treating immune system all the time, then I'm treating stress and anxiety all the time. And then people's chronic conditions start getting worse. So chronic pain, all of that, because stress exacerbates those things. So I just started seeing what can I offer virtually, kept everything as simple as possible for people. So, my time is my time. I didn't change rates or anything like that. I kept the same visit rate for virtual that I would in office. And, walked a patient through whatever they needed, whether that was, I had one patient who I spent the session going through her kitchen with her and throwing out which foods would be good and which foods would be okay. Some patients I do acupressure with, some patients were literally reading their blood work and going over that together and prescribing supplementation. So it was just increasing the virtual options and also the in-home options for patients. But the continued communication was what made me successful during this time and made it a good experience for patients, because even if they were coming in or not, I was still staying in contact with them via email primarily, and got referrals from that.
Wow. That's awesome. That's a great strategy that I think other doctors can utilize as well. I feel like you didn't just go in and just try to hard sell everybody or just go in for the ask. I think you show that you really care about your community, and then, you build up relationships, and then you just start getting referrals. And I think that if we just really in the community, or really just as business owners out there, we focus on building the relationship part and what people really care about, then you can start getting great referrals. So with respect to your time, I feel like this is a jam-packed episode. If you had to give one vital action step or takeaway to doctors listening out there to help improve their practice or take it to the next level, what would you tell?
Get extremely focused on who you want to treat and who you want to appeal to. I think there's a temptation for us to want to help everyone, and that's wonderful, but it makes it very hard for you as one individual, as one practitioner, to decide where your bandwidth's going to go. So an example, if I'm working with men's health and men in their 40s and 50s, it's very easy for me to decide what doctors I'm going to collaborate with. I'm not saying, oh, it's going to be every single person in my building. No, I'm going to need I'm going to need a nephrologist, high blood pressure is a thing. I'm going to need a physical therapist. I'm going to need a chiro. I'm going to need a urologist. So it makes your life with connecting with people a lot easier. And it makes the conversation with that person you're trying to connect with more substantial and genuine. So you're not just dropping off cards in an office. You're able to speak to exactly how you can help their patient. And it just creates more of a value proposition.
That's awesome. And so did you go ahead and write out the exact type of patient you want? Is that okay? Cool.
Which has been very helpful and very clarifying. And once you put that down on paper and you get a very clear idea of target market, ideal patient avatar, and you can literally picture this person in your mind, it becomes very easy to kind of let go of the rest. And I think there's also a power and a professionalism that comes with being able to refer those other patients to people. You're still going to get referrals. I get husbands who bring their wives in all the time. I'm not turning them away. But if there's someone who comes in for something that someone who's better than you, having the confidence to refer that person, like I work with male fertility, I don't work with female fertility. So being able to refer that person, I know 3 incredible fertility docs for women that I refer to, and patients gravitate to that. And those are patients that have also referred to me. Even though I've referred to them, let them to someone else, they will still send people my direction because it's an integrity thing and it's a trust
I love
thing.
that. They see that you genuinely want to help. And because I was going to ask you that and you already answered it, like, how do you stay focused? How do you stay patient? I think especially when you're first starting out, you know, it's hard. Like we started out, we did marketing for 20 different types of clients, right? And then just niching down just into healthcare and doctors was hard because, you know, we had this $100 million e-commerce company knock on our doors. And I'm like, oh, this is so hard. You know, I think my answer there also is, you know, obviously you can't just like turn away all your business and just crush your company. But I think investing in where you want to go is definitely an easy way. And then if you're very clear, like Dr. Nell pointed out, right? Hey, I want this type of person that's really going to help my business. It's really going to take us to the next level. Then you can really much easier market to them and then get in that industry/segment. So thank you so much, Dr. Nell, for the interview. You've won. So go ahead, plug it up. Tell us what books should we be checking out of yours, movies, TV shows, whatever you want us to look at. And also, if we wanted to contact you, you know, what would we do?
Okay. So yeah, I would love if anyone wants to tune into the podcast. We're working on season 2 right now. It's for general population and for practitioners, tangible takeaways each time. It's just Be Well with Dr. Nell. So nice and easy on every podcast platform. For students and practitioners kind of venturing into the integrative medical space, I do have 2 ebooks and a ton of resources for starting your practice, really easy, basic things you can do. All of that is available on bewellwithdrnell.com. And if you're interested in my practice specifically, so all of those men who want to come in and optimize men's health or post-surgical patients, if you're here in Beverly Hills, just looking to feel better, that's Peak Beverly Hills, peakbh.com.
Awesome. Well, thank you guys so much. And that's another episode of Vital Doc Talk.